Welcome to Foundations in Therapeutic Modalities and our focus on individual psychology. By the end of the session, you should be able to discuss treatments using individual psychology, describe modern applications, as well as identify strengths and weaknesses. To briefly overview, in this session we will be exploring treatment in individual psychology, some contemporary applications of this approach, as well as examine some strengths and limitations. Adler's theory is an optimistic and growth-oriented approach, and it assumes that people are capable of change and that they can achieve more fulfilled lives. So Adler also steered away from Freud's idea of the client-clinician relationship to more emphasis on the importance of a cooperative interaction through a therapeutic alliance that involves establishing shared goals as well as a foundation of mutual trust and respect. So clinicians following Adler's approach have a pretty complex role that calls for the application of a broad range of skills and ones that foster social interest, help people to adapt lifestyles and their behaviors and goals. So they are analysts of a sort who identify this faulty logic and assumptions. They explore and interpret the meaning and impact of a client's birth order, their dreams, early recollections, and drives. They are also a role model, sort of consistently demonstrating ways to think clearly for meaning, collaborate with others, establish and reach meaningful goals. Although the stages of treatment in Adler's model often merge and they overlap, he did identify four separate phases. So we'll start with phase one, which involves establishing a positive therapeutic relationship and going about setting goals. Adler believed in the importance of true and caring involvement, the use of empathy, using both verbal and nonverbal techniques to overcome feelings of inferiority and any fear that the client brings into treatment. So encouragement is an essential part of this initial phase and establishing a positive alliance with the client. So some ways of doing this are to focus on the behavior rather than the person and making that separation. The present versus being in the past, on effort and motivation rather than the extrinsic or factors from the outside, and on the positive rather than the negative. So a quick example of this may be, rather than saying, your doctor said there is a 40% chance your cancer will recur. An Adlerian might say, so the odds are in your favor, taking the optimistic view. So a distinctive feature of Adlerian therapy is a focus on in-depth assessment. So phase two is concerned with this assessment, analysis, and understanding the person and the problem. So within this phase are six key domains: identifying information, background, the current level of functioning, the presenting problem or problems, expectations of treatment, and then summary. So we will be taking a closer look at these domains. So more on the second phase. So within phase two of Adlerian therapy, we are seeking to identify and understand our client. The goals of this phase involves gathering and understanding information around family background, lifestyles, private logic, which we've come across already, goals, self-destructive behavior, and any faulty logic. So one of the characteristic features of Adlerian theory and practice is a clinical tool called the lifestyle interview. Adler had more than a few assessment instruments in his repertoire. The lifestyle interview is a a semi-structured process that takes place over 3 consecutive sessions, and it consists of 10 sections. The general focus, however, is on family constellation and birth order, dreams, earliest recollections, priorities, and the ways of behaving or acting. But of particular importance is assessing people's level of satisfaction with themselves, their relationships, and their lives while looking for those examples of faulty logic. Adler believed that people's behaviors provide a really rich source of information about their lifestyles. So inquiring in detail about a person's behavior over a period of time, or looking at a series of choices and actions, can reveal a consistent and repetitive behavioral patterns that are reflective of that lifestyle. And within that, Adler identified common lifestyle themes that are mirrored in the ways in which people essentially orient themselves to the world. In this, we have ruling and dominating, avoiding interpersonal and other challenges, pleasing and seeking approval from others, controlling and managing, depending on others and needing to be cared for, pursuing superiority and perfection, seeking achievement, being a martyr or victim, seeking comfort, promoting social welfare and progress. After an extensive process of exploring, assessing, and analyzing through this second phase, clinicians form hypotheses about the nature of the client's lifestyles, which common lifestyle themes may emerge, as well as the faulty assumptions and potentially self-destructive thoughts and behaviors that are interfering with their efforts to achieve their goals. Phase 3 can be particularly difficult for clinicians because they need to be both encouraging and challenging. So while remaining supportive, they use interpretation and confrontation to help clients gain awareness of their lifestyles and recognize the concealed reasons behind their behaviors, appreciate the negative consequences of those behaviors, and then ultimately move toward positive change. So while sometimes awkward, and whether interpreting or confronting is the technique, the intention is to always send a clear message that the client holds the responsibility for any change. So for example, the clinician might confront by saying, "Do you want to do anything about it?" As in the expressed problem, or do you want to sit and continue talking about it? Of course, tone, cadence is very important, and that encouragement piece needs to be ever present. But whatever comes up, it is important that the client sees as clearly as possible that the responsibility for change is his or hers. So while phase 3 can present as quite clinically challenging, there are several strategies to help clinicians remain caring through this phase of treatment. One of them is focusing on the present rather than the past, being more concerned with consequences rather than with the unconscious motivation behind behavior, and to present their interpretations through the process in ways that are more likely to be accepted and well received by the client. So the approach is more tentative when reflected back. For example, I have a hunch that, could it be that? So there's a tentativeness, and it's not dogmatic and certainly not authoritarian. Once clients have gained some insight and modified their distorted beliefs, you might say, they are ready for phase 4. So phase 4 involves a reorientation of the client's life and an initiation of new ideas and patterns of behavior. So they now view their lives from a fresh or different perspectives, and they can make more rewarding choices. So clinicians support this outcome by helping clients become full participants in their social system, shifting their goals and interactions, and take positive actions to achieve their revised goals. So this reorientation and change phase can now be divided into 4 parts. The first is clients revise their goals and then assess, how realistic are they. And the clinician assists the clients to use, common sense and rational thinking to their feelings and their beliefs and their goals. And the new learning is applied to the client's life, and any barriers to progress are identified and consequently removed. So this final phase also marks a collective determination, if you will, on when the client is ready to finish treatment and an agreement on a follow-up to see how successful and able the client is to maintain the new focus. Adler's individual psychology offers a pretty wide range of creative and useful interventions, some of which we've already mentioned in this session, but here are some additional techniques that clinicians can use. One is called catching oneself. So this is a technique which encourages the client to be more conscious of their repetitive faulty thinking. Now, this is a concrete strategy that allows a client to develop self-awareness and monitor themselves without being self-critical. So anger and losing one's temper is a really good example, or a client can be taught to identify the physical signs of anger, view that as a flag, and use a technique such as deep breathing as a way to diffuse that. Pushing the button is designed to help people become more aware of the control they can have over their emotions rather than allowing their emotions to control them. And I'd like to think of the distinction of responding rather than reacting, though this can sometimes be very subtle. Spitting in the client's soup, it's a slightly repulsive metaphor, but this is where the clinician identifies the motives behind the client's self-defeating behavior and then makes it even more unappealing. So spitting in the soup is about bringing a persistent pattern of negative behavior into the other person's awareness without blaming or shaming, and it requires an already strong therapeutic rapport to be successful. So this technique may have limited situations where it could be used. However, it can also be an excellent reminder that it is perfectly okay to notice negative patterns of behavior, point them out within the context of a warm therapeutic relationship. Some other useful Adlerian techniques include immediacy, which is exactly as it suggests. So it focuses on the interaction between client and clinician in the moment. And it's thought to often be a mirror of the client's interactions outside of the session. So that can be quite helpful and offer insight. Another one is prescribing the behavior, which is also called paradoxical intention. So paradoxical interventions or prescribing the behavior involves prescribing the very symptom the client wants to resolve. So it's a complex concept often equated with what we might call reverse psychology. So for example, the client fears failure. So the therapist asks the client to fail at something, literally. A man has a problem with procrastination, so the therapist asks him to schedule 1 hour a day to procrastinate. Those are a couple of very concrete examples. Again, we exercise caution with how we deliver those kinds of messages. Confrontation. And the clinician in this technique points out incongruent behavior. So for example, the clinician might say, "Help me understand your decision to spend $4,000 on earrings when you've expressed your concern about being able to make the down payment on the house you want to buy." You can see the incongruency of that. And again, the delivery is hugely important, and having built a therapeutic alliance would be key. Just a few more interventions. Adlerians use task assignments, and they are used throughout treatment. Important to note that they are discussed and the terms are agreed upon between the clinician and the client. So homework is literally an agreement upon assignment that the client will take home, sets out to achieve, and then brings a result, so to speak, back to either the next session or the agreed upon time frame to sort of reassess its success, if you will. Other techniques like humor, silence, advice, and reflection feelings are some other tools that can be used. And there are many other interventions associated with Adlerian therapy, so it offers clinicians many ways to build rapport with their clients, promote insight and self-awareness, and ultimately encourage positive change. What are the modern treatment applications for Adler's individual psychology? We know that it can be used with a broad range of situations and clients. So it is used for treatment with children, teens, families, individuals, and couples. And it's also used for areas like career development in educational contexts, supervision, training, consultation, and also organizational development. So Adler's focus on lifestyle assessment and understanding private logic has been instrumental in developing these assessment tools. As we are coming to appreciate, individual psychology can be used in psychotherapy with most problems and mental disorders that present in therapy, and it is substantiated by the research literature that is out there. So people with drug and alcohol problems, criminal behavior, and other impulse control disorders can be understood through this process and helped through this particular model. So things like disorders of mood, anxiety, personality, traumatic experiences, and the like. So the other aspect of this that is appealing is that Adler speaks to diverse and multicultural populations as the process actively seeks to address the problems that come with discrimination. So it lends itself very nicely to multicultural groups. As with other approaches that are focused on background, Adlerian therapy is no exception. It has limitations. So Adlerian therapy understands and gives credence to underlying psychological and societal impacts on pathology. However, it kind of comes short in terms of taking biology or genetics into consideration. So we now know, for example, the impact of genetics on anxiety and mood disorders, schizophrenia, and others, as well as the biopsychosocial factors at play in the development of many conditions. So as well, some of his concepts are not clearly defined, such as fictional finalism, which again sort of leaves them at risk for oversimplification. And further, there's also debate regarding his concept of social interest being innate. In spite of individual psychology's limitations, the strengths and contributions are enormous. And modern psychotherapy and counseling integrates many of Adler's concepts, some of which are holistic approaches, so mind, body, and spirit considerations, the impact of early experiences and family constellation, understanding how thought influences emotions and behavior, and the importance of a collaborative therapeutic alliance. So there's many others we could consider. However, perhaps the greatest contribution is Adler's emphasis on respect for individual differences and the importance of each of us becoming an integral part of a larger social system. What are some ways we can evaluate individual psychology across the world of psychotherapy? Well, individual psychology can be incorporated into modern therapy. It focuses on beliefs and behaviors, merging with cognitive behavior therapy, rational emotive behavior therapy, reality therapy. Lifestyle assessments shares commonalities with narrative therapy. So there's lots of ways that we can connect it to current day practices. Let's summarize and highlight key moments from our session. Individual psychology has made many valuable contributions to counseling. It has practical applications with a wide range of people and issues, provides a valuable framework for understanding people and their situations, and the tools and interventions developed from Adler are relevant and effective.